The Illness Management and Recovery Program begins with an orientation session. The purpose of the session is for people to understand the nature and the goals of the program and to set positive expectation for change. The practitioner goes through the information on the orientation sheet one section at a time.
Well, nice to see you, Joanne. How are you today?
Okay, Kim.
Great.
Yeah.
What I'd like to do today is to spend a little bit of time talking with you and orienting you to this program that we've talked a little bit about before, and that's the Illness Management and Recovery Program. And we're going to be spending a little bit of time together, actually meeting on a regular basis over the next several months. And so what I really want to do is to spend time helping you understand what the program's about and what you can expect in terms of it. What we have here is a orientation. It's an orientation sheet to the Illness Management and Recovery Program. And I thought what we would do would be to just go through it together, and I can spend time letting you know what it's all about. And if you have any questions about it, you can ask me those questions.
Okay.
All right. Well, first of all, the goals of the program. And the first goal is to learn about mental illness and strategies for treatment.
Okay.
And the idea behind this goal is that we think that it's really important for you to be as informed as possible about the nature of your illness and what the treatment options are, so that you can become in charge of your own treatment.
Okay.
And the best way to do that is to be as informed as possible. And so a lot of this program will involve teaching you basic information along those lines. The second goal is decreasing symptoms. Not everybody, but many people who have experienced psychiatric symptoms have those symptoms on an ongoing basis, may be persistent. For some people, the symptoms may come and go. But if that's an issue for you, in terms of having some ongoing symptoms, we can spend time helping you develop strategies for either decreasing those symptoms or coping with them so they don't interfere with your life as much.
Okay.
Does that sound like that might be of interest to you?
Yes, I think so.
Great.
Okay.
And then the third goal is reducing relapses and rehospitalizations. Now, we're going to be going through a series of educational handouts. And the handouts summarize the information that is taught in this overall program. And what we could do is just walk through the different educational handouts so you kind of have a sense of what's coming up. But I'd be really interested if one of these sounds especially interesting to you, let me know about that, and I'll make a special note of that. And we can make sure that we spend maybe even some extra time on that one.
Okay.
So the first one has to do with recovery strategies. And what that has to do with is strategies or things that you do to help you pursue goals and changes that you would like to make in your life.
Okay.
Based on what recovery means to you. You're going to be involved in defining recovery in a way that's most meaningful to you. Recovery from mental illness. Now that we've talked about these, I'm just curious, are there any that particularly come to mind that that you find especially interesting?
Probably building social support.
Okay.
Because right now, basically, my mother is the only person in my life.
Right.
And I'm a caregiver, and I'm always giving.
Right.
And I recharge by going to OA meetings and
Yep.
AA meetings and coming here to mental health.
Uh-huh.
But that's about it.
Right. So there's an example of something we could focus on would be building more social supports and,
Right.
and getting people closer to you. Also, it sounds like you're under some stress in terms of your caregiving role for your mom.
A little bit. After 10 years,
I
it starts to
bet.
take a toll.
Yes. So it may be that there are some things that can be learned in the coping with stress as well.
Definitely.
Great. And
Okay.
coping with symptoms. Participating in assignments. And one of the things that I'll be doing at the end of each session is you and I will put our heads together and try to come up with some kind of a home assignment or homework assignment for you to do on your own in between the sessions. In fact, in many ways, much of the learning that goes on in this program goes on outside of the sessions. When you take something and you try to use it on your own, and you see how it works, and sometimes it works great, sometimes there's problems, and then you can bring that back in, and we can talk about that and find out how it went. So at the end of each of the sessions, we'll be coming up with some kind of a homework assignment that'll involve you following up on, it might be on one of the goals that you've set and are working towards. It might be on something that we covered in that session in one of the educational handouts. That sound all right to you?
Sure, sounds great.
Great. So any last minute questions about the program?
Let's see. I'm especially interested in reducing relapses and rehospitalization
Okay.
right
When was
now.